Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Today, I'm suffering from a case of contagious enthusiasm, and the reason for that is that a lot of the work that I've been doing over the course of many years has been additionally scientifically validated, and I'm going to share that with you today. Our topic today is relatively comprehensive. It's going to be about pain, pain management, what you can do about it, and about anesthesia at large. Now, if you haven't figured out by now, what we do at my practice is that we do chiropractic care, acupuncture, physical therapy, and medical hypnosis. The report recently in regards to hypnosis is that they're finding out that there's a resurgence of using medical hypnosis as an alternative to anesthesia. And a large study performed at the University of Belgium in Belgium took 5,000 major cases, major surgical cases, and in that they performed hypno-anesthesia. The vast majority of those patients could undergo major surgery just using hypnosis as a singular form of anesthesia. The other patients who that was inappropriate for, they found that they could use a combination of hypno-anesthesia and mild anesthetic. Now, what was that anesthetic amount? That amount of anesthesia to bring the person to a state that they would normally be anesthetized with by just medication alone was 1% of what they would normally use to anesthetize the patient. So over the years, I'd been thinking about, boy, well, why isn't that used more? How come we haven't incorporated these natural means in our surgical rooms and surgical procedures? And then as thinking about it, I said, because it's probably not cost effective. In our society, the medication cost less than the anesthesiologist's time that it would take to perform the hypnoanesthesia prior to the surgery itself. But now, with this new information, there's a great equalizer that's come out of it. What they find is that the person who undergoes hypnoanesthesia heals quicker, has a greater rate of recovery, and returns to work on an average, after having major surgery, with just regular anesthesia, the person returns to work in approximately 29 days. A person undergoing hypnoanesthesia returns to work in approximately 15 days. Now that is major and it's huge. And the reason is that I feel when a person's anesthetized, it's like using an elephant gun where you're putting the person out in such a way that it takes a good week to 10 days for your body to demetabolize all of those chemicals associated with anesthesia. So as a result, rather than your body immediately going into the healing phase associated with the surgery, it has to first deal with clearing the garbage out of your system so that it could go ahead and finally heal itself. Now, I'm thinking insurance companies, once they kind of catch wind of this, will start to see the intrinsic value of this natural approach within our surgical arenas. By using hypnoanesthesia, person gets better quicker, it's more cost effective. So what happens is that the work loss associated with using traditional anesthesia versus the hypnoanesthesia is the way to go. So that's what I think we're going to find. We're going to see hypnoanesthesia start to take over, and we're going to see smaller and smaller and smaller doses of the anesthetic. Now, how this all works is normally, and how this integrates in with pain, is that surgeries, the trauma that it has on the body, and the reason to be anesthetized is that person doesn't, they want the person to be sedate and calm while they're undergoing a surgical procedure, and they don't want the person to be yelping out in pain if you're being or needed to be cut into. So now we segue into the pain portion of our conversation. Traditionally, what's happened is that when a pain response is elicited for anywhere for any reason in your body, a signal is sent to your midbrain, and then it's sent to the subcortical region of your brain, and then it's sent up into the cortex of your brain, and within that region is where you actually experience the sensation of pain. When a person's anesthetized using traditional medication, is that the pain signals go from the hindbrain into the subcortical region, but don't reach up into the cortex region of your brain. They find out now through these studies that hypnosis brings the person and reacts the same way. The signals go up to the midbrain, into the subcortical region, but do not go up into the cortex, so that your body is not experiencing the pain. So it cuts down on it so dramatically that it's the reason why they need either low or no amounts of sedative, just to help to regulate that transfer of that neural signal up into the brain. What they also find is that the use of hypno-anesthesia or use of hypnosis can help not just with the pain at the time, but also helps with post-surgical pain, meaning it has a lingering effect within the mind. So since this has all been studied in regards to surgery, now this information transposes onto using medical hypnosis as a form of pain management. Now, sometimes people come in to see me and they have problems that aren't necessarily going to be cured or solved. They may have permanent neurological problems, they may have organ-related problems, an autoimmune disease, things where pain is what people have to experience learning to live with. The problem is that in using medications, frequently, the longer a person takes pain medication, the less of an effect it has, because there's an addictive quality to it, and it no longer does the prescribed work that it's going to do. So naturally, a person takes more and more medication to get less and less effect, whether it's an anti-inflammatory or whether it's some type of, strong pain-killing prescription medication. What they find out is that using hypnosis as a tool to condition one's mind, they can either end up using low, possibly no, but much lower doses of medicine, allowing the person's physiology to not be so traumatized by, being laid out with drugs to the point in which the drugs are going to end up killing a person quicker than the pain is. I know sometimes we have to make a decision between what is, what functionally we need to do. Managing pain is an important component. But if it's reaching a point of diminishing return, now we must reevaluate where this role of natural health care comes into play. So using medical hypnosis, we put and condition a person's mind and use post-hypnotic suggestion to condition these pathways in a person's brain to cut down on the pain signals for chronic, irretractable problems that there's no known cure for. So this is very, very exciting. I've stayed very busy with doing this work for years, but once this new kind of information comes out and becomes more accepted and understood and embraced by you, the general public, is it finally going to be incorporated into people's lives? So for years, I've been doing sessions of pain-free childbirthing for women. They come into the office and they want to have their baby, but they don't want to be anesthetized. They don't want an epidural when they have their baby. So what we do is we do a session of anywhere in between 3 to 4 sessions of hypnosis, starting at about 6 weeks prior to the anticipated delivery date. And we condition the woman's mind to being able to bypass the nature of that pain that they would normally experience during childbirth. With this new scientific validation, I'm sure that I'm going to be significantly more busy with this work as the actual pathways are understood and people now, realize how it works. People were thinking, I had women that came, but they were thinking it was kind of mystical, like how does this work? Was it mind over matter? Well, really what it is that it is a matter of conditioning your brain to respond adequately. Now, I studied acupuncture here in the States, but I also did an internship in China. And the reason why I went there was that I went to study acupuncture anesthesia. And the reason is that I felt if I could be really good at doing acupuncture anesthesia, then when I came back, I could be really, really good in assisting my patients in managing their pain. Because if I could do good in one, it would easily transpose into the other. And I was correct. And when I was there, I saw many interesting things as far as surgical procedures that were done just using acupuncture and acupuncture, electroacupuncture during the course of surgery and as a preconditioning for the course of surgery. So what we've started to incorporate for people that have chronic pain, we're incorporating the use of acupuncture anesthesia in a mild electroacupuncture form coupled with laser and hypnotherapy, all in a comprehensive package to help them manage pains that are not curable to date or that are permanent in nature. And these types of techniques can help them go from dysfunctional pain, which is people that just can't seem to function well at all, to being low to no or tolerable pain. Sometimes it's not a matter of eliminating all of the pain, but if we can see a decrease of the pain from anywhere from 30, 40, 50, 60% of what it was originally, aren't these things of value in your life if that also causes you to take less medicine and it has a long and protracted effect on one's system? In re-examining how the actual acupuncture anesthesia works, it works along the same pathways and influences the same pathways that it does with anesthesia, that it does with medical hypnosis, and it influences the brain and the brainwave patterns to not register the pain in the cortical region in the same manner. So people come in, they have arthritic conditions, they have fibromyalgia, which is a chronic muscle disorder that creates an inflammatory response and pain. These conditions respond very well to the nature of the treatment and is diametrically different from the other things that either we do as far as the physical therapy and chiropractic care or the medicines that are available. So this whole avenue is totally opened up now to help to condition a person's sense of well-being. Now, in a moment, I have a special guest that will be talking about pain and different types of pain, and stay tuned. Back with us today, upon popular demand, is Dr. Kenneth M. Kirsten, chiropractic physician, sports medicine doctor, and clinical hypnotherapist. Dr. Kirsten, welcome back.
Good to be back.
So, Ken, what did you think about that new information in regards to, the medical studies about hypnosis and its ability?
Well, it's good to see because many people, when they come in for hypnosis, talk about hypnosis, they think it's some mystical thing, and they really don't realize that it's actually a medical procedure. In 1955 or 58, I think it was proven by the American Medical Association as viable treatment for medical conditions. And when most people come in for hypnosis or talk about pain, they ask, "Oh, does it really work?" And we're like, "Well, that's why we're doing it." And it seems to, at least now, coming to more of a fruition now that people are actually accepting it and treating it as a real thing and not just a mystical thing or something taboo or something that is a gimmick, but it's actually a real thing, and showing that how much pain is subjective and how much mind is over matter.
Right. That's an amazing aspect. hypnotherapy has been used for hundreds of years. And what I did was I went back and I researched the fact that it used to be used quite regularly for surgery and pain management prior to them finding ether, right, like 100 years ago. Once they found out about ether and they could put a person out is when the science of medical hypnosis was pretty much, kind of put on the back burners and was nothing more than like a parlor trick or parlor act, something like that.
Right, and also in the Eastern countries, with like the yogis and things of that nature used to do it, lower their heart rate, lower their physical, even change appearances sometimes in regards to just actually slowing physical conditions down to lowering their heart rate, lowering many things, controlling pain, doing all these things, but it still seems mystical. But now come to Western culture, hypnosis is now used by psychotherapists and medical doctors and things. And even in the forms of, we're talking about hypnosis, we're not even talking about specifically actually putting someone in a hypnotic trance and doing this, typical people think of hypnosis, but in emergency medicine or in medical community, hypnosis, we call waking hypnosis, is extremely important. And adapted for people that first arrive on scenes, like EMTs and things of that nature. If you think about it, hypnosis is a part where a person's critical factor, we call critical factor, is broken down, where their conscious mind is not there because they've been in trauma or something of that nature. And the first suggestion that comes to them in regards to the medical attention is crucial in regards to controlling a person's excitement, vitals, things of that nature. It's like, okay, settle down, it's okay, you're going to be fine, or as opposed to someone coming to the scene like, oh my God, this is horrible, the patient's never going to make it. Well, that doesn't give the patient any better chance. So even when those doctors, those nurses are interacting with those patients when they first come in, they're doing hypnosis without them actually even knowing it, because the person is scared, their critical factor is broken down, and the first suggestions they're getting from these medical professionals are extremely important, and that can make the difference of either patient making it or not making it.
That's really an interesting comment, because I never really thought about that before, like having a basic hypnosis course for like EMTs or
Absolutely.
first arrivals on the scene. That actually would be really valuable. And even if the anesthesiologist didn't necessarily want to take on the role of the hypno-anesthetist pre-surgically, they might have nurses that are specially trained to do that in tandem or hand in hand. It would really be better for the patient, more cost savings. We've been talking, and focusing on real physical pain and trauma. There's also the emotional component. To people that have, anxiety and depressions and grief and things like that in such an oppressive way that, hypnosis is also a good adjunctive tool. It's not necessarily going to take the place or needs to take the place of talk therapy, but sometimes people talk about things ad infinitum, and you know what? They still have the same stinking thinking that they did. So just like what we're talking about hypnosis, cutting off these abnormal signals to cortical areas of the brain, where we can frequently eliminate these reflexively bad thoughts, meaning your same old stinking thinking about yourself is the same old cruddy way in which you were thinking a long time ago. It can have an erasure quality to it.
Yeah, because pain, like I said before, although it is a real thing and it can be measured, it's still to a certain degree subjective. What may be painful for you may not be painful for me, or vice versa.
Yeah.
And it depends how the patient interprets it, and that's when it becomes real, because the way they're interpreting it, that's what it gets translated to the cortex, and saying, well, I'm either appreciating this pain or I'm not appreciating this pain. So, and again, same thing like we talked about chronicity. People all of a sudden kind of get used to pain. A thing I always say to people is they feel that either they're better or worse because of pain, and that's not true, because pain is the last thing to come on and the first thing to go away. So what I mean by that is they can have a trauma, not have any pain. All of a sudden, 2 days later, pain comes on, and now they're in a lot of pain. And then we go through some treatment. Boy, I feel better. My pain's gone. I'm better. That's not the case, because the healing process is going on. You're changing, and then all of a sudden, they'll either stop their treatment too early, or they'll go about doing something too aggressively, and then all of a sudden the pain comes back. So pain is a measurable marker, but yet to some degree, it's very, very subjective, depending on how the person interprets it. And through hypnosis or suggestion, it can be more easily controlled and allow the person to heal better faster. Even, like I said, even make physical changes.
The interesting thing in some of these studies that they've been doing, they take a heat probe, and they turn the temperature up, and they have it to hold it like a certain distance away from a person's body. This is on the test subjects that they're going to use, and what they'll do is they'll turn it up to until that point where a person just can't stand it anymore, and that would be a 10 out of a 10, for rating of the pain. And of course, even within there, what one person could stand, another person couldn't stand. So there you get the variances or differentiations of pain and pain syndromes. And then they determined what the 10 of 10 was, and what the duration was, and then they did hypnosis on the person, and then after they brought them out of hypnosis, they did the same thing. Even after they brought them out of hypnosis, they did the same thing, and what was a 10 of a 10 was like a 3 of a 10. Mm-hmm. So, just demonstrating the fact that these pathways can be influenced not just during the course of the treatment, but have a carry-on effect with that.
Sure. It's studies like this, and again, this study was done in Time magazine, so it's not like some other, it was posted in Time magazine. So we're saying that, this is something that actually is extremely important, and maybe now coming to, a little bit more of, like I said, to fruition now, so that it can be incorporated, and these small things done in the medical, in like any healthcare professional, can utilize these things and really enhance the outcome of a patient's progress.
Yeah. Now, talking about different types of pain, you have referred pain. Give us an update.
Well, talking about the physical nature of pain, basically, there's pain, there's referred pain, there's radiating pain, different types of pain. Pain is appreciated, like we said, through the mind in response to what we call afferent input to the body, external stimuli. An example. Hitting your elbow. Everybody's hit their funny bone. They hit their elbow. That nerve is an ulnar nerve that runs down here, and it feels like you got stabbed.
I hate that.
I hate that. But the first thing you do is rub it. And when you're rubbing it, it's not something that's just done to. It's actually you're actually blocking pain by that. It's an actual really mechanical response. What you're doing is by rubbing the surface receptors, so that you're rubbing the what we call the mechanoreceptors. You're stimulating the mechanoreceptors. Mechanoreceptors are nerves that are in joints and things of that nature to help block pain. So when a person hits their elbow and they rub it, it's actually doing something therapeutic. You're actually stimulating the mechanoreceptors to help block pain, to help block those pathways. So that would be like a localized pain. Then there's referred pain and radiating pain. Difference between the two. Radiating pain is pain that is derived from a specific, what we call like a nerve root compression. Example, herniated disc. Arthritic compression on a nerve that would cause a very delineated line-like pain. I have patients because I take a pen and draw my pain from my neck down my arm into my first finger. That would indicate to me that that's a true musculoskeletal condition, directly from nerve compression, maybe from a disc, arthritis, bone spurs, things of that nature. But I know it's coming from the nerve root. Whereas opposed to a patient comes in and says, I got pain in my back here, and then I kind of feel it over here, and then I kind of feel it over here. It skips areas. That, to me, tells me there's a referred pain. So as opposed to a specific nerve root compression, maybe coming from like a herniated disc in the low back, that could be something very simple as a muscle spasm, or just a simple joint mechanical problem where there's what we call the sacroiliac joint, where the hip meets the spine here. If that is fixated or has some inflammation in it, that will send a referred pain in what we call a sclerotogenous pattern. A sclerotogenous pattern is a pattern that we call developed sclerotomes. It's a map of the body from how we developed it. If you have pain in a certain area, it's going to send or refer pain to a different area of the body. So that automatically tells me that this patient is probably not in as acute pain as a person with radiating pain. It could be more easily fixed. And when that's knowing it's about getting half the diagnosis right there, just from telling me what type of pain there is, I could pretty much pinpoint where it's coming from and why it's there. So those are very important to differentiate between those two. Plus, if it's palpable, if I can take my finger and put it on there, on the pain, and then actually send or refer the pain, then I know that's musculoskeletal pain, and we can help correct that. Whereas opposed to if someone comes in and they have periodic pain, they said, my shoulder kind of hurts, really was no trauma, it's really not influenced by any motion, I can't palpate it, I can't reproduce it, Now I'm thinking something that's like a visceral somatic referral, where if they're having right shoulder pain and it happens after a meal, I'm thinking more gallbladder, because the gallbladder will refer pain up to the back and to the right shoulder. It doesn't have to be just where the problem is. Pain does not always exist where the problem is. You have to look around it. So if you just treat or focus on the area where the pain is, you've been missing out on a lot, to find that tracking pattern where it could be coming from.
Yeah. How about, let's say, arthritic pain in elderly people and them utilizing intermittent chiropractic care? I mean,
But that type of pain is usually due to degeneration. Arthritic, good old osteoarthritis, DJD, caused by osteoporosis, good old wear and tear injuries. Basically, the best thing for those patients to do is move. We're talking about stimuli, afferent input. Everybody feels better when they're moving in regards to arthritic pain. That's why they feel stiff and achy in the morning when they get up. But as they get to move around a little bit, they feel a little better, loosen up, but it gets worse at the end of the day because they've done too much or what have you. So if you find that moderate level of improvement or moderate level of activity, to maximize that movement, joint mechanics, lubrication of the joint by moving, it's the best thing you could do. Exercise, walking, swimming is a great way to eliminate a lot of pain, discomfort, to get movement in the joints. And people, we just call it rocking chair pain. Feel good when you're rocking back and forth in a rocking chair. If a person just sits in a real old rocking chair and rocks back and forth, I'm serious, moving the ankles, because there's a high amount of receptors in the ankle. Moving the ankles, you can help decrease pain and make yourself a little bit better, just like you are when you rub your elbow.
Well, I wonder what's better, a Adirondack rocking chair or one of those sliding gliders that they, that would be the more traditional method. How about this this therapy you're doing at the office, is decompression therapy with the elderly people? Is that
Yeah, when we're talking about joint restrictions, as long as you're getting some movement in the joint, that's what matters. And some people can't tolerate an aggressive manipulation, so some gentle traction to the low back or the cervical spine is quite sufficient.
Dr. Kirsten, your knowledge knows no boundaries. For Natural Healthcare Alternatives, I'm Dr. James R. Golding, and thanks for viewing.